Anticoagulants, Antiplatelets, and Thrombolytics, a comprehensive guide. Welcome to today's video on anticoagulants and antiplatelets. We'll break down their mechanisms of action, indications, and important considerations in a clear and easy-to-follow way. Let's dive right in. Generally, anticoagulants have almost the same mechanism of action, which is they inhibit clotting to prevent clot formation that is just straight. However, since some of them inhibit specific clotting factors, we will discuss them in each drug class just to make it clear. Remember, they do not dissolve existing clots like thrombolytics, which they break existing clot. We are going to talk about that in a minute. Now, the first class of heparins. Mechanism of action is they inhibit clotting factor thrombin 2A to prevent clot formation. In this drug class, we have the following drugs: heparin, enoxaparin, dalteparin. Indications: prevention and treatment of PE, DVT, and post-surgical clot prevention. Antidote for all three drugs, heparin, enoxaparin, and dalteparin, is protamine sulfate. Some consideration we need to aware is that we do not mix heparin with enoxaparin and dalteparin. Anticoagulants, coumarins. In this class of drug, here we have only one drug, which is warfarin. Mechanism of action is they inhibit clotting factors like thrombin, TIA, to prevent clot formation. Warfarin is used for long-term prevention of thromboembolism in atrial fibrillation, AFib, mechanical heart valves, post-MI. Antidote for warfarin is vitamin K. We educate patient to avoid inconsistent consumption of vitamin K-rich foods like green leafy vegetables. Direct thrombin inhibitors. Mechanism of action is they inhibit clotting factor thrombin to prevent clot formation. In this class, we have the drug called dabigatran. This drug used in stroke prevention in atrial fibrillation, AFib. The antidote for this drug is idarutuzumab. Selective factor XA inhibitors. Mechanism of action is they inhibit clotting factor thrombin XA to prevent clot formation. In this drug class, we have the following drugs: rivaroxaban and apixaban. Indications: deep vein thrombosis, DVT prophylaxis, for example after knee-hip replacement surgery, and pulmonary embolism, PE treatment. Remember, all anticoagulants we have discussed so far have the same mechanism of action, which is they inhibit specific clotting factors like thrombin to prevent clot formation. Now we have antiplatelets. Mechanism of action: inhibit platelet aggregation to reduce clot formation. Commonly used for ischemic stroke and MI prevention. Here we have two drugs. First, aspirin. It required in low dose, around 81 milligrams, commonly used for stroke prevention. Common side effects include GI bleeding, risk of ulcers, and Reyes syndrome in children. The second drug from antiplatelets is clopidogrel Plavix, used post-MI and for stroke prevention. Side effects: flu-like symptoms, hypotension, and epistaxis. Finally, we have thrombolytics. Mechanism of action: dissolve existing clots to restore blood flow. Some of the common drugs in this class are alteplase, TPA, retiplase, and streptokinase. Indications: acute MI, ischemic stroke, life-threatening pulmonary embolism. Additionally, remember to administer within the therapeutic window for maximum effectiveness. That's it for today's video on anticoagulants, antiplatelets, and thrombolytics. I hope this breakdown gave you a clear understanding of these important medications. If you found this video helpful, don't forget to like, share, and subscribe to my channel for more educational content. Let me know in the comments what topics you'd like me to cover next. Until then, stay curious, stay motivated, and keep learning. See you next time.